Chair, and thank you, Mr. Secretary, for being here today. 15 months ago, the Republican tax scam bill passed and was signed into law, and I said at the time, and it's even more true today, the impact of that legislation has led to exploding deficits and therefore also has led to the President's budget calling for a 12% decrease in the HHS budget. This budget continues to promote the long-sought goal of dismantling the Affordable Care Act by another failed attempt at so-called repeal and replace the law, and weakens protections for people with pre-existing conditions. This would leave millions of Americans without meaningful health insurance. Over 10 years, this budget calls for a $1.5 trillion cut in Medicaid and a $500 billion cut in Medicare, partially offset by inadequate investments in health plans which bypass consumer protections. The cut in Medicaid is approximately $1 in $4 spent today, resulting in millions of Americans losing their coverage. The budget does provide a very modest $291 million towards the President's call for halting the spread of HIV. As chairman of the House Foreign Affairs Committee, I'm particularly opposed to cuts in funding for global AIDS programs. There's a 22% cut in PEPFAR, used to treat millions internationally, mostly in Africa, a program started by President George W. Bush. There's also a proposal to water down the U.S. contribution in the Global Fund to fight AIDS, TB, and malaria from $1.35 to $1.1 billion. Inexplicitly, we also see budget slashes to the CDC of nearly 10%. Funding for the NIH takes a 12% cut of $4.5 billion, with the National Cancer Institute absorbing most of that hit. Can you imagine that? So, Mr. Secretary, this HHS budget is completely unacceptable and is a direct threat to the health and well-being of all Americans. I have a couple of questions. I'd like to ask you, Mr. Secretary, yes or no, can you guarantee that cutting almost $26 billion from hospitals that serve low-income and uninsured individuals will not result in a reduction in services, endanger access to vulnerable populations, or contribute to hospital closures?
I'm not sure which particular cut to hospitals you're referring to in $26 billion. If it's the Medicare changes on hospitals gaming the system by jacking up private practice rates when they buy a physician practice.
Dish payments is what I'm referring to. Under this formula, some of the largest dish cuts will be on states that chose, like mine, that chose to expand Medicaid, while states that rejected Medicaid expansion will get much smaller cuts. So with the additional dish cuts you're proposing, continue this policy of punishing states that expanded Medicaid with steeper hospital cuts?
Correct me if I'm wrong, but I thought the point of the Medicaid expansion actually was tied to dish payments going down. That was part of the funding mechanism in it. I may be mistaken, but I think that's actually part of the original, what President Obama and the Congress enacted, and we're sort of carrying through on that,
how do the cuts in the CDC and NIH budgets promote life-saving research for those Americans desperate for a cure?
Those are the cuts at CDC and NIH are a challenge, and it's a starting point. With a tough budget environment, these are difficult choices. We've tried to prioritize, and I understand you or others will disagree with those choices, and we're happy to engage in an ongoing discussion. It's a starting point for that.
The choice I'm really against is the choice that gives tax breaks to very wealthy people in exchange for what we're seeing right now in this budget, hurting the poor and the middle class and their ability to have adequate health care. You have hospitals in my district and all surrounding districts that serve a high number of Medicaid patients, and the uninsured are a critical part of our health care infrastructure, and they ensure that our most vulnerable citizens have access to the care they need when they need it most. And these hospitals rely on funding, I know you know this, through the Medicaid Disproportionate Share Hospital, or DSH, to help keep their doors open and their lights on. And Medicaid DSH payments help support hospitals across the country in all types of communities, urban and rural. And at the end of this year, hospitals will face substantial cuts to their DSH funds if Congress doesn't act. So the President's budget, the way I look at it, doesn't propose to reduce or delay these cuts. Instead, it doubles down and proposes increasing the size of these cuts over a longer period of time. And by your own projections, this would result in $25.9 billion in cuts to Medicaid DSH on top of the $44 billion in DSH allotment reductions under current law. I don't see how hospitals will be able to sustain cuts of that size. Could you please explain to me how that would be possible?
Again, I believe that's inherent in the Affordable Care Act structure, and in terms of uncompensated care, I thought that the Medicaid expansion and the Affordable Care Act were supposed to get rid of the uncompensated care. So, we can't keep the old system and have the new system on top of it and keep paying the same amount of money. That's at least our perspective in the budget.
But let me just say, Madam Chair, and then I'll end. To me, it doesn't matter as long as we're not pulling away help that people need now. It seems to me that from these cuts, there's no way that you can call it any other thing, but we're taking money away, and many, many more people will be left uninsured and will have no help. And to me, that's not the way we should be going, providing tax cuts for the wealthy in exchange for everybody else getting screwed.